Good morning, and thank you so much for joining us for this edition of Focus on South Texas. Dementia affects over 6 million people across the country, and navigating care can be a challenge, but there is a program that is helping caregivers with stress and alleviate the burden of providing care. Here to tell us more about the Guide Model program is Mona Talukdar, Vice President of Development with the Alzheimer's Association, Lisa Ayers, and caregiver Bill Zinsmeyer. Welcome to the show. Thank you guys so much for joining us.
Good morning.
Good morning. Thanks for having us.
Well, first off, Lisa, what is dementia and its impacts on the caregiver and the family?
Sure. Well, dementia is the umbrella term. There's multiple different forms of dementia, Alzheimer's being the most prominent. Here at the Alzheimer's Association, our goal is to eliminate Alzheimer's and all forms of dementia. But until we get there, we need to support our caregivers. We know that actually now 7 million people, the number is growing, are living with Alzheimer's or dementia, and over 11 million people are caregiving for them. And so caregiving can take a toll. It interrupts people's finances, it interrupts their work life, their career, their family dynamics so much. It truly is very difficult for the family, and it affects all of the family, from children to spouses to siblings. Even extended family have to come together to caregive for one person with Alzheimer's or dementia. And so we are really excited about this guide model and the ways that it can possibly help people go through the Alzheimer's or dementia journey.
And speaking of that model, Mona, what is the GUIDE program, and how is the Alzheimer's Association involved with this?
So the new GUIDE program is a brand new program by Medicare. They have been working on it for years, but now it's in an implementation stage. It's a very innovative program. First time, the focus is moving from the patient to the caregiver. The caregiver is the one who's caring for their loved one. So the GUIDE model is a guiding and improved dementia experience. In that program, Medicare has come up with multiple benefits that we can provide to the caregiver to relieve burden and stress, and also encompasses care navigation, which is very important for helping the caregivers how to navigate the healthcare system. So the most important part of a Medicare program for the respite care part is basically Medicare is going to pay for private duty care, an adult daycare center, and a 24-hour stay in a place in case the caregiver wants to go visit their family or a loved one and needs that 4 or 5 day break. They can place them, or we can place them as a guide participant in a memory care unit or nursing home to give them that 24-hour stay so that the caregiver has a relief. In addition to this, the GUIDE program also includes comprehensive evaluation. It includes medication management. It includes, the most important part is caregiver training, giving the tools to the caregiver so they can manage the patient at home, reduce hospitalizations. We also are going to be allowing them to help them with post-acute navigation in case they go to the hospital, in case they have a fall at home. We as the care navigators or the care navigators in the office, we will become their personal secretaries. They can pick up their phone at 24/7 anytime and call us and say, this is happening, can you help me? Or my husband has behaviors, can you get someone to help me? They have a change of status. So we become their personal secretaries or navigators to allow them to navigate the health system. It's an amazing program. First time Medicare is changing the shift from patient itself to the caregiver. And that's where we need to focus on, is how do we give that help to the caregiver to relieve their stress, to relieve their burden, so they can manage their loved one at home very well. So it's very interesting.
I love that. And for those that are wanting to access that, how do they go about doing that?
So if they can go on the Medicare website, they'll be listed. The GUIDE participants are listed on the Medicare website. If they just Google GUIDE participants in Bexar County, you will find UT Health Science Center and visiting practitioners in palliative care. These are the two programs selected by Medicare. Medicare selected around 390 organizations in the entire country. In the South Texas is UT Health Science Center and visiting practitioners. So we are the only two programs here currently that will be navigating the dementia patients for the entire South Texas. Yes, other programs are going to come in slowly, but these are the two primary programs in the Bexar County right now.
I love that. And Bill, tell us a little bit about taking care of your wife, and how did dementia affect your life?
Well, it's a it's a very devastating disease. when you're told that your loved one or my spouse had Alzheimer's, we didn't really understand and how much it affected our lives. First of all, this is a disease that has no cure, number one. Number two, it's a long, drawn out disease. It's a long, long goodbye. So it affects the person who has the disease, yes, but the caregiver is really strung out because that is their lifeline. And many caregivers, again, don't have the wherewithal and finances to handle the issue of caregiving and to keep up with what's going on. So it takes every part of you as a caregiver. There may be one, there may be two. In my situation, it was just me for a while. I was able to finally get some help, but it's very, very devastating and disruptive. The one thing I will tell you that the guide can present is to giving that caregiver some assistance and getting some of the answers that you need, which I was trying to work hours to get answers. Guide will take us out of that situation. But the most important thing is I call ourselves love givers. We're not just a caregiver because it draws for a long time. This isn't like someone getting cancer. This isn't like someone getting a heart attack. It goes on and on and on.
My condolences to you for your wife, and I know you carry her with you every single day.
Yeah.
Thank you also for sharing your story and for helping be an advocate for other families. What advice would you have for family members that are caring for loved ones with dementia?
Well, the first and foremost would be to get a hold of the Alzheimer's Association, which is all forms of dementia. And secondly, I think they will guide them to programs such as the Guide and get them involved in different programs. We do have an incredible program in the Biggs Institute here, which just started when my wife became ill. We were on our way to Houston, and the Lord gave us the Biggs Institute. That's a big blessing for San Antonio. So there are more help. There's more help now than when there was before, but there's still people lost. There's still people lost. And the other thing is they have to come forward. What I see more than anything is they're not asking. And I wish they would come ask, because they could settle their issues that they're dealing with, especially the stress that we can help them with.
Absolutely. And Lisa, how can the community get involved in supporting the Alzheimer's Association and find out more about the programs and the guidance?
So you can reach out to us at alz.org. We also have a 1-800 number that we encourage people to call 24 hours a day, 7 days a week. Everything we do is free. We have in-person support groups, we have online support groups, we have education programs we can bring out to organizations or businesses to educate people about the issue. But first, take that call, and again, it's 24 hours a day, so if the only break you get is at midnight, give us a call and we are here to help. But as far as people supporting us, we have a gala coming up May 17th, which is going to be at the Whitty at the Mays Family Center, and we still have a few tables and tickets available, so we encourage people to reach out. Again, alz.org will lead you there to come out to our gala. And then in November, we have our Walk to End Alzheimer's, which grows every year because the need grows every year. Last year, we welcomed over 4,000 people to Fiesta, Texas, and we'll be there again on November 8th. So we encourage families to come out, form a team, or just come out and be with people who know exactly what you're going through.
All righty. Well, Mona, Lisa, Bill, thank you so much for being on the show.
Thank you so much for having us.